Hello everyone, I am Amita from Nourish Doc, a platform for your natural and holistic therapies. In today's session this morning, we are going to be talking about a very interesting topic. The topic is anti-aging medicine. So joining me is going to be Dr. Darvish, a naturopathic doctor who specializes in anti-aging and regenerative medicine. So there you are. Good morning. How are you?
Good morning. How are you?
I'm amazing. Yes, amazing. Thank you so much. We are all staying home in California, so that's good.
That's great. That's great. Well, thank you for having me.
Absolutely. I was just telling our viewers about our topic. It's a fascinating topic. Now, all of us want to look great and we don't want to age. And how can we maintain our vigor, and slow the aging process? So that is our topic, anti-aging medicine and regenerative medicine with Dr. Nooshin. So maybe you can tell us a little bit about yourself before we go into the questions.
Sure. Well, I'm a naturopathic physician licensed here in Washington, and I've been practicing for over 25 years.
Mm-hmm.
And in the last 15 years, I've become more and more involved in regenerative medicine, which is really extension of what naturopathic medicine is, which is looking at the root cause of illness and believing and understanding that the body has the capacity and the wisdom to regenerate and heal itself.
Got it. So let's talk about, is there a difference between anti-aging medicine and regenerative medicine, or is it still the similar kind of a concept here?
I think it's an extension of an anti-aging medicine. So I'm board certified in anti-aging medicine and regenerative medicine.
Mm-hmm.
And, or I should, yes, board certified. And so anti-aging medicine was really the first opening to regenerative medicine. Anti-aging medicine uses, hormones. A lot of the focus is on looking good and feeling good. But regenerative goes beyond that. It's looking at what can we do to actually regenerate the cells, the organs in our body, right? So it's even a deeper process than just anti-aging. And anti-aging is really not quite a good term, I think, because we cannot anti-age, but we can slow down the aging process.
That's right. Yeah.
And by doing that, we're actually stimulating the regenerative systems in the body.
Got it. So let's talk a little bit about, on a personal, like all of us, like what can all of us can do to rejuvenate and revitalize and our bodies and ourselves, especially in COVID times. I mean, this is sad that you see so many people suffering. So what can we do? What can all of us do?
Well, cellular regeneration can slow down, or degeneration, I should say, actually. Degeneration can slow down. Yeah. And as we do that, we're slowing down the aging process. It's a process called senescence. And so if we can slow down the damage to our DNA, we're going to slow down the aging process. And that is really the key. And what the things that we can do, the basic things like getting to bed in time and eating clean food, organic food, lack of, that's void of pesticides and chemicals, which are, by the way, very damaging to our DNA. Drinking clean water, getting enough oxygen and exercise, some of these basic things, and avoiding toxins that often cause damage to our cells, like alcohol and chemicals and body care products that are full of chemicals. So there is a lot of things that we can do to slow down the damage of our cells. But of course, aging continues, right? Yeah. And stress is a big component of that aging process, that damage to our cells. So when we're stressed physically, mentally, emotionally, then we're going to age faster. And, you see some of these spiritual gurus that they look really young, right? And it is really because the science is now showing that meditation can slow down the aging process.
Wow.
Right? We know that. We know meditation can transform the DNA. We know things like vitamin D and B12 can slow down the aging process. We know that B12 can regenerate the myelin sheath, the sheath around the nerves.
That's
right?
Unbelievable. I mean, all these have studies, like clinical trials and studies.
Lots of studies on
up,
them.
right?
You know, a lot of studies on a lot of this, and more coming forward. But now we're moving into regenerative process, regenerative medicine, which is, by the way, the fastest growing segment of the medical industry right now, because everybody wants to anti-age, slow down the aging process. We've got so much work to do. Our purpose is so much greater than we ever thought. We're coming to that realization. And so we want to extend our life. We want to make it an optimal living, right? We don't want to be suffering as we get older. We're watching some of our parents as they suffer, and we're hoping that we don't get there. So what can we do to shift that, despite the amount of stressors that are coming at us, like the work stress, the family stress, the electromagnetic frequencies and cell phones and computers, you know, those are all very damaging to ourselves. So if we can at least do things that we have control of, like the food and the sleep and the meditation and prayer and so forth, then at least we're combating the intense stressors that are coming to us to some extent.
Got it.
Right? But then there is therapies that are being studied more and more, like peptide therapy and stem cells and exosomes and platelet-rich plasma, and all of these different types of what we call regenerative therapies that stimulate the body to heal itself. The difference, though, is that between what we practice and how I practice and typical regenerative medicine is that I really look at the root cause of illness. So, for instance, if you have a toxic exposure like mold, and you try to give that patient stem cells or exosomes, you're not going to get very far. Your success rate is not going to be very high, because that invading agent, that toxin, is still causing damage to that cell. So we have to remove the mold exposure. We have to clean up the body from the mold, give the body the nutrients it needs, make sure that the body's being fed the good food and the clean water and the sleep and all that, and then give it the stem cells, give it the exosomes, give it the platelet-rich plasma, give it the peptides. Then we get to see how much better that individual becomes. Our success rate goes way up.
Got it. So let me ask you one thing. So you talked about you have to remove, right? So all of us have some type of toxins, because we're surrounded by toxins.
Yes.
No matter what we do,
yes,
like you and I do. So what is so if someone walks in and you know, what would you tell them to detox? First of all, you talked about that you have to remove the mold. So what are the high level tools, you know, from a naturopathic point of view that you will use? Like, would you also use some kind of you know, like supplements or some kind of an herbs, or combination of what you talked about, the food, you know, or you know, like in Ayurveda they have all these panchkarma therapies, right? So help us educate, like what are the tools that naturopathic medicine, as a naturopathic medicine doctor, you would do?
Well, you know, I've had a little bit more extensive training, actually a lot more extensive training than the average naturopathic physician out there. And so one of the trainings that I've and experiences that I've gained is that we have to treat the body at the right time with the right tools. So identifying what is the first toxic insult to the body, what's the priority in the body, is important. It's like having a combination lock. Right? You have to put the numbers in that combination in the right order. First, figure out what the numbers are, and then put them in the right order. If you just throw the numbers at it, it's not going to shift. And it's the same thing with our body. If we've got mold toxins, if we've got emotional drama, if we've got heavy metals, if we've got a chronic virus, whatever that may be, if we're not addressing it in the right order, then we're not going to get very far. And that is where the art comes from, right? The art of medicine comes in figuring out what's first, what's second, what's third. And sometimes you treat the first thing, and because it was such a big block, it allows the body to suddenly open up and regenerate and heal and do what it needs to do to reverse the the disease process or the symptom process. But so in that, if you're thinking of it that way, then we are using tools that may be involved in releasing the emotions.
Oh, wow.
Okay, so there may be some, you've heard of emotional freedom technique, the tapping technique. There is various types of emotional release techniques that we use, some that I have personally developed myself. So homeopathy, there may be some things that we need to do in order to address the emotions, if that's the first thing. If it's mold, I may use IV therapy, because if it's very deep-seated, I may need to use phosphatidylcholine, for instance, to help the body eliminate the mold. I may use some supplements. I may just use food.
Wow.
Right?
So it's not like...
It's not one.
Yeah.
No, it's not one fits all. Everybody is individual. And that's the beauty of each one of us, is we are so beautiful and so perfect in so many ways that we just need to acknowledge that and meet that individual at that level of where they are at.
That's beautiful. Right? So interestingly, that comes another question, like, how in functional medicine, they have all these testing, then they test you first and then they figure out, okay, this is what is you are deficient. So do you also use some kind of a testing?
Yes. So we use a combination of Western, Eastern, natural bioenergy medicine, functional medicine, anti-aging medicine. So what that means is that a patient may come in, I'll do a physical exam, I'll take a history, I'll do some blood work, maybe I need to do some imaging. But at the same time, I'm doing some nervous system testing, I may do computer testing, I do functional tests through functional medicine labs, I may do hormone testing. I mean, our tools are so vast that we can pick, what's the right thing for this individual. Right. And it's this balance of the science and the arts. It's the balance between the right and left brain that is so magnificent. And so I have so much passion for it. I've had this passion to have this balance between this harmony between the science and spirituality, between the right side and the left side of the brain, between the arts and the sciences. And if we can just perfectly incorporate that, integrate it into healing, then individuals are just transformed. And that's really the bottom line, is to transform lives from within.
No, absolutely. So is there a secret sauce? I mean, you talk about so many things.
It is. I know. It's so many things.
Yeah.
Is there a secret sauce to what?
Secret sauce of I think well, you did talk about the secret sauce of slowing down the aging process by eating right, by cleaning ourselves. I guess that's all part of the secret sauce, and you are the enabler. You are the sort of like the guru that's leading its disciples. You know what I'm saying? Like
I like to think of it as the hollow reed. You know what a reed is? Do you know what a reed is?
Yeah.
So it's that pen that the ancient pen that they used to write with.
Yeah.
And the hollow reed is allowing the flow of love and energy to come through me to the patient, the wisdom that is in the universe to come through me to the patient, the knowledge that's in the universe to come through me. So I like to think of myself as a hollow reed.
Okay. I think it's amazing. It's amazing the kind of work that you're doing. It's absolutely fascinating, and educating people, how to take care of themselves, and then they will, like you said, that the body will heal itself and regenerate the cells.
Yes.
And a lot of women, and not that I want to quote anyone or generally, but as we start aging, there's a whole concept of at least a few years back of Botox and all that stuff, and but we fail to understand as human beings that if we take care of ourselves, like you're talking about, your emotions, release of emotions, the food, the lifestyle, we would look fine. We would look good, like the yogis you're talking about.
Yes. I'm almost 52 years of age.
Oh my God! Wow, amazing. And what do you do?
I have never done any Botox. I have never done any fillers. But I practice what I preach.
Okay. So let's talk about, can you talk about your routine, like a daily routine? I think it'll be an amazing example for all the viewers. So starting when you wake up. Is that too much?
No, it's not too much, but because I really focus on allowing what comes to me for that day. So I'm not the type to have a routine where I'm just boom, 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 because sometimes that routine for me can be very stressful.
Yeah. Yeah.
Right? Yeah. But typically I get up and I meditate. Actually, I meditate and pray before I get out of the bed.
Wow. Amazing.
And sometimes if I have a chance, if my day is going to be starting a little bit later, I may meditate up to 2 hours.
2 hours? And what do you
sometimes
meditate?
And I have to tell you
this is coming a completely different discussion now.
Yes, it's a completely different discussion.
Yeah.
I will meditate, and not because I necessarily am timing myself, but I'm allowing to have the universal knowledge and secrets come to me. Yeah. And so I will lay there and I will have my hand on different parts of my body. Like if I'm feeling a stress, I get up and let's say I'm feeling my tension in my neck. I'll put my hand on my neck, and then I will hold it there. And this is after I've said a few prayers. Yeah. And as a Baha'i, I feel very, very blessed because we have prayers that have been revealed. And so they say a prayer or two, and I put my hand on my neck or my abdomen or wherever I'm feeling that tension. And then colors will come to me, or images will come to me, or a history from way back childhood will come to me, or maybe an ancestor will come to me.
Wow.
And I allow that image to be there until there is some message sometimes that comes to me, like a voice that will come to me, or nothing, or sometimes it just needed to be acknowledged.
Yes.
And then I let it go, or it naturally lets go. Okay. And then I feel, oh my gosh, my neck is so much more, looser and able to move easier, or the tension in my abdomen is gone. And then I focus to my body again, and then I'll see, oh yes, I've got tension around my liver area and the right upper quadrant area. So I'll put my hand there and do the same thing.
Yeah.
And sometimes it's focusing, for instance, on my dad who's passed away, and I'll focus on him and see what message he has to give me, or I'll focus on a question. I'll have a question that I'm pondering, and I'll pose that, and I'll hear a voice that will say, "Be patient," for instance, for now. Time will come. The time will come. Little things like that, so that it allows me to not be stressed with the day-to-day drama that goes on.
No, right? I think it's beautiful. It's beautiful. Anyone has any questions or comments? I see a lot of people, like a stream of people who have joined. So you're welcome. And someone is requesting to join the live. I'm sorry. This is not, we can have a separate session with Dr. Nooshin on FB Live, and people can join us and ask all kind of questions. If you have any questions, you can put it in the comment. But it's beautiful. It's absolutely beautiful. 2 hours of meditation is a long, long time. But
yes. Typically, I do, 10 minutes, 15 minutes, 20 minutes maybe. But sometimes it goes up to 2 hours. And then I'm always having, if I eat that morning, because sometimes I'll do intermittent fasting.
Okay.
But not every day, but maybe 2 or 3 times a week. Yeah. And then I may go for a walk or do some kind of an exercise, not for very long, maybe 20 to 30 minutes. I'm always drinking a couple of glasses of water first thing in the morning.
Yeah.
And then my food begins after that, and it will be, all whole foods, organic. Yes. I don't eat any chemicals. I don't drink any alcohol. I've never smoked. I've never drank in my life. Wow. I don't have a desire to drink. I'm a good sleeper, thank goodness. I go to bed early, and I try to get at least 8 hours of sleep.
Yeah.
And then, as I'm getting older and the amount of stressors coming on to me, I notice that, my hormones are acting up. And so depending on the day, if it's a stressful day, I may take some bioidentical hormone therapy. And that's usually cream form.
Mm-hmm.
And then, and I have purpose. My purpose driving to work is that I want the best for everyone. Whoever walks into my office, whoever walks into my room, I want to be a source of service to them. And that is my intention every day. And that's, and I ask for the universe, for the creator to help me in helping whoever walks into my office. And so I think that sense of service is a huge anti-aging for me. Huge anti-aging. And I think it's for everyone. If they have a service to help others, if they have this intention of making others happy, then it reflects back onto us. And we feel happier, we feel more enlightened. And as a result, the DNA gets a chance to heal itself, and so the aging process slows down.
Yes. Happiness has a lot to do with it. And there have been a lot of studies that have been done on laughter yoga,
Yes.
right?
Yes.
And the telomere, the DNA
Yes.
scientist here, but I know enough about the telomere, the length, it keeps decreasing, and then it kind of, you can maintain it, or that's what it's heard on the clinical studies. Beautiful. And are you a vegetarian also? You don't?
I'm vegetarian. I'm pescatarian. I will eat fish a couple of times, maybe 3 times a month. But I'm mostly plant-based, yes.
Plant-based, okay.
Yeah.
Well, I think a lot of, you have given us the secret sauce. That is you.
Well, the secret sauce is really being joyful. Honestly, it's being joyful and being a source of service to others. And whatever you can do to do that creates well-being and slows down the aging process. And of course, all these other stem cells and exosomes and everything else we use is an extra bonus. But really, you cannot be dependent on that stuff. It has to start from the roots, from the grassroots level. And it starts when we're babies, where we're even in the womb. So as mothers, it's vital that as mothers, we're happy and joyful and taking care of ourselves before we even get pregnant, right?
That's right. That's right. And there's a lot of research now. It's coming up. Our mothers didn't have to prepare for being pregnant. You know what I'm saying?
Yes.
Like, I don't remember my mom saying, "Oh, I'm going to have a baby. Let me prepare for it." It just happened. We just popped up, right? Popped out. I should say that. And now in our generation, they say, 6 months before you have to detoxify, you have to prepare for the baby to come. I mean, it's completely different.
Well, it's a different society we live in.
Yes.
Different world, right? Our parents didn't have all the chemicals and the electrical and the electromagnetic frequencies and the pesticides and herbicides and dental amalgams and medications. I mean, every baby that pops out, they give them Tylenol. Right?
Yeah, I know.
So, I mean, they didn't have any of that, and their body started naturally, and it continued on a natural basis with very, very low toxic stress to their system. And they worked in groups. All the women always gathered and helped each other. Now we find women are clashing with each other and head to head versus coming together and working together. And I think that is the other aspect of anti-aging, is really building a community around ourselves, building a community that is nourishing to us, that we love just for the sake of love, right? And nothing else.
Yes. No, I think beautiful, what you're saying. Amazing session. To everyone who's been watching, please help us share these sessions. We are trying to bring these amazing sessions every day. And I think this is one of the fascinating sessions that I have, done with you. Thank you so much for being with us.
Thank you so much for having me.
Yeah, absolutely. And we'd love to have you again on, educating us a little bit more on maybe a different topic. But
sure.
Yeah.
Maybe more of the science.
Absolutely, absolutely. Yeah, more of the science. And but this is a good intro. This is an amazing intro what you said, and you shared your example of what you do, and that's I think itself is so amazing. So with that, I'd like to wrap up this session. To everyone, let us know your feedback as always, and thank you so much, Dr. Nooshin, for being with us.
Thank you so much for having me. Have a wonderful day. Enjoy, be joyful, and be happy.
Thank you. Thank you so much. Bye.
Bye-bye.